Trying to attempt herd immunity in the United States would result in a very large number of fatalities. That solution is absolutely unacceptable, is misguided, is rooted in a misconception and misperception of what the disease is. The numbers can be sliced in multiple ways, but there is an undeniable reality, and is that around the world, the case fatality rate of this disease hovers around 2%. That is substantially higher than seasonal flu, is much higher than many of other diseases that we encounter on a regular basis. If we let this run amok among our population, we will see results that should have not happened. As a frame of reference, in this moment, COVID is the third largest tragedy in American history by total number of deaths. We only have two larger tragedies. One is the Civil War and the other is World War II. COVID is third. So by allowing herd immunity to arise spontaneously through infection, we're on the path to making COVID-19 the largest tragedy when measured by human lives in American history. So it's an absolutely not acceptable direction.
And as we say, that would be putting it nicely?
This is the nicest words that I can say on air.
Well, so then why even bring it up? I guess that's another question that you probably were asking yourself. Why are they even talking about this if certainly they should be aware of what you know?
This COVID-19 crisis sadly has coincided with an election cycle. And this attempt to minimize the risk of COVID seems to be geared toward scoring some political points to an electoral base at the expense of the entire nation.
And yet Dr. Atlas says he's not advocating it, while others in the White House are saying, yeah, it's in the vein of herd immunity. Yet he's saying, no, I'm not advocating it. Well, then what? What is he doing?
I don't know what his thoughts are. I know what his words are, and I know what the words of the administration are and have been in multiple media outlets and in press briefings. The attempt to minimize the impact of COVID-19, it's just a pitiful attempt to gain votes with a very small base, and is neglecting and ignoring the facts that we have emerging every single day in every single county in the United States. This disease is not over. Actually, it is growing in some states. The total number of deaths that we will observe this year alone is extremely high and could go higher if we let this just spread in the population in a fool's errand attempt to try to gain herd immunity. Some people point to the Swedish experiment, pointing that they didn't close the economy, but sometimes those people fail to notice that the death rate in Sweden is much higher than that of the US. And Sweden is a small country. We are nearly 35 times larger, or 30-something times larger. Multiply the number of deaths they have by the number of Swedens that could fit into the US, and you will see where this tragedy could go.
Oh my God. Well, so then certainly you've painted the world view, you've painted the national view. What could herd immunity mean in San Antonio? What could that do to San Antonio?
Well, first of all, the concept of herd immunity is often cited, but the context is usually lost. The context of herd immunity arises when we study vaccines. It's studied in that context. We don't have a vaccine. When we talk about herd immunity, is the hope that there will be some immunity in the community through exposure. So in the city of San Antonio, when we had a number of cases that were growing very rapidly in July, herd immunity could mean let that growth continue. And if that growth continues, we could see a large number of people infected in the community. Because as time passes, people might feel the need to, or feel the inclination to lower the guard. And if that message is put forward by the federal government, that it's okay to get sick by COVID, that infection to the community has a positive outcome, then we could see that acceleration that we had in July. We didn't see a very large number of cases in San Antonio because the governor mandated face masks throughout the state. And that had a profound impact. We were racing to 250,000 cases by the end of summer. It did not happen. And it did not happen because there was, at every political level, there was an understanding that we had to put a brake on this disease. And we are today at a place that is not optimal, but is not terrible. And we are here because the message to the community has been, we are not done with COVID. COVID is not done with us. We have to keep pushing that message as opposed to let people think that it's okay to get infected. And if we let everybody get infected, we will acquire this herd immunity that might or might not happen with COVID-19. So it's a bad idea from every possible angle that you look at.
And finally, and this is certainly an important point that I was reading in the CNN article about nursing homes, that apparently Sweden didn't take into account nursing homes and how this could affect them. So can you imagine what this would do to our nursing homes that has already seen so many die and so many put at risk?
Mm-hmm. Congregate settings like nursing homes, jails are particularly prone to have large outbreaks of this disease. If we remove the brakes from the disease, if we stop doing what we're doing, then we expect those numbers to climb up. And because nursing homes, particularly nursing homes, cater to the elderly, the age group that is more likely to develop symptoms and complications, it's very easy to foresee a profound impact in number of deaths that we would have if we just lower our guard in this moment, in this pursuit of herd immunity. Now, herd immunity, as it has been presented, doesn't necessarily mean, and this has not been said to the best of my knowledge, that we will stop protecting ourselves against the disease. However, by putting forward the idea that there is something called herd immunity that would protect the communities if we let more people get infected, sends the message to people that we don't need more protections. And COVID-19 will come back with a vengeance. We have seen it in every single locality. When there are government orders that lift restrictions, cases start going up. We don't expect any exception to this rule as we move particularly into the colder season. With the arrival of winter, we might see an increase in cases. And if history teaches us, teaches any lesson to all of us, is that a century ago, the second wave of the influenza pandemic was 5 times deadlier than the first wave. If COVID is the third tragedy in American history by number of deaths, and the winter wave materializes, COVID could become the largest tragedy by number of deaths in American history. So that's why it's so important to send a message to our communities. Be vigilant, put all the protection measures in place, especially wearing those face masks. That's the most important tool that we have. And then we will be able to keep it at bay. There is no herd immunity for this disease without an exceedingly high human cost.
Oh boy, thank you so much, sir. And of course, like you say, normally it's when there's a vaccine, you know, that's a whole other situation, but we don't have a vaccine. And so, you know,
and
way too soon.
The approaches that we have of using adenoviruses as vectors for the vaccine might not be optimal. And there are instances, for example, in the early 2000s, there was an attempt to develop an HIV vaccine using the same type of virus vectors that are being used by some of the large companies trying to produce a vaccine. And it was observed that people who received the vaccine were more likely to get infected with HIV than those who didn't. Just very recently, there was a scandal in the Philippines because Sanofi, the French drug manufacturer, fast-tracked a vaccine against dengue, just to find out that kids vaccinated with that particular vaccine were more likely to develop complications as compared to kids who were not vaccinated. So developing a vaccine is not a simple task. And that's why the multiple phases of a clinical trial have to take place. If we don't go through those phases very carefully, collecting high quality data at every single step, we are risking going into a situation like what has happened in the past, in which vaccines, a defective vaccine might make things worse. So it would add to the problem as opposed to offering a solution. So until we have a vaccine, we don't have it. And until that happens, there is no herd immunity.